How to do HIV self-testing. Preparing the test kit. Place the test stand on a flat surface. Tear open the foil pouch at the tear point. Carefully remove the buffer cap. Insert the buffer cap into the test stand placed on a flat surface. Massage the finger for 5 to 10 seconds. Clean the finger with an alcohol swab and allow to dry. Uncap the safety lancet. Place the red or opened end of the lancet on the side of your swabbed fingertip. Press down firmly to prick your skin. Squeeze out the first blood drop. Wipe the blood with a sterile gauze pad. Squeeze out the second blood drop. Fill the tip of the testing device with blood. Running the test. Position the test device vertically above the test stand. Push hard through the foil and you will feel 3 snaps. Check for a pink or the purple flow in 1 minute. If there's no pink or purple flow, push the test device further down. Wait 15 minutes. Read the results between 15 to 20 minutes. Do not read the results after 20 minutes. Reading the results. Negative result. If the test shows only the control line, then your test result is negative. Test again in 3 months. Positive results. If the test shows both the control line and the test line, your test result is positive. Visit your nearest HIV testing center or healthcare professional. Invalid results. If your results do not match the negative or positive results, the result is invalid. It is necessary to run another test. Visit your nearest SAIL clinic or healthcare professional. For more information, consult the SAIL clinic pages. How to do HIV self-testing with SAIL and SHIP and our partners PEPFAR, USAID, and EPIC.